DeviceNation Academy 2026, the inaugural booth crawl. So excited to be hanging out with Martin Ostmann here in the Osteoremedies booth, looking at some new things, some things you probably haven't seen before, and some papers that are talking about some things that they have had out that's really cool. Martin, welcome to the Big Easy, sir.
Thank you, good to be here.
Great team of people surrounding us to talk all things infection. What's new, what's exciting?
We have a lot of new stuff going on this year in our quest to deal and manage with infection. So first up, we have the BioBrush, which we launched a few years ago, the 42 millimeter version, which has been great, makes debridement much easier, debridement of soft tissue, bone, as well as implants. And now we're rolling out in the next few months with this one, which is the 24 millimeter small BioBrush, really responding to what people have said about, the BioBrush is great, it makes it much easier, but this one, you can get into the small spaces around the knee, get into the back of the knee, and yeah, we're excited about that one.
You should be. There was a paper that came out recently that was going through the rounds on social about the toothbrush versus pulsatile irrigation, and that this is more efficacious. Just as a rep, and I don't know if the surgeons can chime in on this, but when I'm going through one of these cases, watching it, and I see that little toothbrush get opened on the field, I'm like, we're going to be here a while. I can probably check my phone at that moment. Any thoughts on that for you guys, or is it not a big deal?
Yeah, I use a toothbrush, and what I like about this is the bristles.
Yeah. Right.
If you use a toothbrush, it is mangled after a couple of minutes. It's like this will really hold up during the case.
Yeah. I've used the big BioBrush a lot, so I'm excited for this little one to getting all the nooks and crannies around the hip stem and getting the back of the knee and all that.
Great.
Yeah. I have no idea if what I'm getting ready to say makes any sense, but when I first saw it, you get into these metal disasters and all that tissue with metal debris in it and all that, and I wondered if you've ever seen this brush used for something like that to help clear that out.
I have not personally seen that, but it is indicated for both soft tissue, necrotic, also live tissue, so it would make sense that you have an area that you want to clean up and get in there, that this is going to do the job. And compared to a toothbrush, like you mentioned, this is validated for safety on those tissues, unlike kind of a do-it-yourself solution, as well as hooking up to the power makes it much easier to just apply that mechanical action that you're looking for.
All right, what's next on the buffet, Martin?
Next up, very exciting. This came out about a month ago. We've had a handful of cases. This is the POLY+PLUS knee tibia. So this goes with the Remedy system, the stemmed knee system, and it is an all poly tibia that articulates against our PMMA femur. So it gives you all the benefits of the full system where you have PMMA that elutes antibiotics. However, this poly component gives you an articular kind of setup that's a little bit more designed for function in that interstage period.
We took a poll before we got started with all y'all. Everybody's had their hands on Osteoremedies at some point, right? What do you think? Is that a good ad?
I personally think it's an improvement. Just it's going to be a much smoother articulation. I think patients can feel a little bit of that grind from the cement on cement. I think this will help get rid of that.
Yeah, I think it's a good solution for your low demand, really sick patients that you're going to do one surgery and they're going to live with it. And like you said, it's a lot smoother than what we had before.
You'll feel more like a normal total knee.
Right? Yeah. What do you think, Dr. Bodner?
I think the spacers are evolving. I think, there's more push towards putting them in and seeing how they'll last on their own because they can. And this is improvement in design for that.
As a rep, I've sold 1 million cement spacers. That feels different.
It is much different. We're just about to publish our wear data on that, which our wear data looks much better than it does on PMMA, which makes a lot of sense. And then just from a usability standpoint, we did a lot of unique things on the underside. It has some channels and some ability to grip the cement. A lot of the ways that we talk about Remedy spacers, they're very easy to take out. You can focus your surgery on the infection treatment, the debridement, those types of things. This is going to be very easy to pop out because it's going to grab onto that cement. Another nice aspect is just the simple sizing. We have small, medium, large, interchangeable through the system, and then we have a 13 millimeter and a 17 millimeter height. So just able to gap those in the revision setting, and then you can couple on our 10 millimeter augment as needed to just dial in what you need. So quick, easy surgery that gets a good orthopedic outcome.
Anybody using any of the stem extensions with their constructs?
Yeah.
That's just so much easier than wire and a chest tube. And even though I know people like to craft these things, right? That's just to
Right.
me.
All of it's peel packed, open it up, cement it together. Really just no fuss, very simple.
So Martin, right in front of me here, tell us about what's going on with the hip.
Okay, so same sort of philosophy here. We've done this on the knee. We're rolling that out right now. Very, very soon we are going to come out with the same version, POLY+, but this for the Remedy hip system. So this is going to be a POLY+ acetabular component, cement in, and that's going to articulate against a new cobalt chrome head that interfaces with the Remedy stem system. So this is able to dial in. You're able to use the threads here to get the offset you want. So you have a fully kind of modular setup, and you get the articulation again that you're looking for on that functional spacer, but you have the long-term antibiotic elution and a pre-coated stem.
What do you think, Gus?
Does it cement in just like the older version? You mix the cement in, let it set up while you're cleaning, and
Exactly, right?
Yeah.
So you're going to mix your cement, you're going to put cement on the threads, that's going to hold your femoral head on there, the cobalt chrome, and then you're going to cement in your two components. Pretty straightforward, same technique.
gotcha.
What size head goes on that?
So we have a 40 millimeter as well as a 44 millimeter head. So it's pretty standard across the orthopedic industry. You can use that stem, and you have a size that you're very used to on both the acetabular side and the head.
I was in a case recently where the person doing the case didn't have a lot of experience cementing in liners. Any suggestions from y'all that you've seen in your practice that work well?
Yeah, I think there's a couple of techniques that you can use to make them last longer. You look at really cementing primaries right out of Europe. You can drill up into the acetabulum to get some cement intrusion into that, but you really have to pressurize it if you want it to stay. Now, if you're planning on coming back in 6 weeks, you really don't care so much, so don't do that because it makes it harder to get out. But if you're really trying to do a 1.5 and make this last, you can do that, or you can actually put screws up into the ilium and down into the ischium, and that screw down into the ischium really helps anchor the cement so that it doesn't roll out and makes these constructs last a lot longer.
That's awesome. What about viscosity? Any thoughts on where in that time frame you need to put the cement in?
Long time ago, we used to cement acetabula in.
Yeah.
And you'd get a ball and you let it get doughy, and you didn't put it in till it was doughy. You don't want drippy stuff in there, and then you work it like silly putty, and then put your cup into it.
I try to get cement on the back of the component as soon as possible, but then the actual cement that you're working in the acetabulum, like if you get it runny, it's just going to run all over the place and not be usable.
I have seen that a lot. Take your thumb, push the cement into all those. That's very well designed, by the way. You got a lot of pockets on that thing to grab cement, and then you're pushing in cement on cement. What a cool development there, Martin. So when are we looking at that again?
Let's say summer 2026, coming
Okay.
up soon.
Very soon. It'll be here before we know it. Any final thoughts, anybody? Anybody want to weigh in? Good?
Yeah,
I think it's real
like
good.
this company is leading the way in these pre-made spacers.
Yeah,
It's wonderful.
Making our lives easier. It's nice to not have to build these on the back table and wait.
What a perfect closing statement there.
Oh, I was going to say, I think it's a great option just to hold the leg out to length, and patients are a lot more comfortable and a lot more functional after that.
Agreed. Martin, home run.
Awesome.
So appreciate you inviting us in the booth to see these cool new things that y'all are bringing out. Wish you guys great success here in New Orleans, and on behalf of DeviceNation, thank you.
Thanks so much for stopping by. Appreciate it.